So for us it's a great privilege to be here with the president of the American College of Cardiology, Dr. O'Hara, and the relationship between this great medical organization like ACC and the Spanish Society is a great privilege and an honor for us, this relation, and thanks for being here for this short talk and short interview. First, as president probably of the most relevant, at least from the clinical point of view, medical organization all over the world, what is the main objectives of such important medical organization?
Well, thanks very much, Jose. It's an honor for me to be here with you and have an opportunity to share thoughts about how the American College of Cardiology and the Spanish Society of Cardiology should work together. The most important mission of the ACC is to transform cardiovascular care so as to improve the outcomes of our patients across the world. And we would like to hold ourselves to a standard that at some point in the near future we can see continued progress with respect to a reduction in the incidence of major heart and cardiovascular disease events, and then more importantly to promote heart health and wellness among our younger generation and patients at risk of heart disease.
Yeah, this is for us as also a national medical society.
Yes.
Is our most important goal, and particularly now in the Spanish economic situation, our society is focused on promoting the quality of care.
Yes.
Of our most important social achievement, that is our public health system. So this is the reason why many Spanish cardiologists are directed to the ACC for years, my generation particularly,
Yes.
because ACC was the meetings and the educational activities were focused on this goal, promoting the quality of care. And what concrete so initiatives that the ACC take care in the States related to the quality of care and the performance of care in cardiovascular patients?
We have several initiatives by which we assess quality and we determine performance of individual practitioners and hospitals. And our most important program in this particular area has to do with our national cardiovascular data registries. And the ACC has championed the use of registries as a quality tool to assess performance and to assess adherence to guidelines and to assess adherence to appropriate use. And we are fortunate to have been in a position to look at the experience in the United States with major cardiovascular interventions such as PCI or defibrillator implantation, carotid stenting, and we're now embarking on investigations looking at peripheral arterial disease intervention. And recently as well, we have started a registry in partnership with the Society for Thoracic Surgery and with the Food and Drug Administration and industry partners looking at quality outcomes with TAVR. And we expect to extend this to looking at outcomes following transcatheter mitral valve procedures as well. So the ACC is highly focused on incenting quality and high-level performance among its practitioners.
Yeah, and several years ago, our society becomes a chapter of the ACC. For us, it was very important, as I mentioned before. For us, we are very honored with the relation with the ACC, and particularly because the Spanish cardiologists are many ACC oriented.
Yes.
The JACC journal and the continual medical education. How do you see for nowadays and in the future, this relation between so important medical association like yours and our society, the possible implications in the Latin America,
yes.
and the Spanish-speaking cardiology.
Yes. Well, I think you have highlighted some major issues. One is that the ACC shares much in common with the Spanish Society of Cardiology. ACC members, by and large, practice the art of cardiovascular medicine. They practice the science of cardiovascular medicine. And in order to do that at the highest level, the ACC provides the educational tools to make sure that the knowledge base is adequate, especially in such a challenging time when information around cardiovascular disease and cardiovascular therapy is expanding exponentially. And we see our relationship with the Spanish Society of Cardiology as primarily founded on issues related to education and issues related to assessment of education and the performance as a consequence of attending an educational meeting or as a consequence of completing a self-assessment program. And I know from our conversations previously as well as just earlier today, we also share a great deal in common around the issue of registries and how to use them as tools to investigate quality and make sure that all of us as cardiovascular physicians in our own communities are operating at the highest standard possible.
Yeah, we are committed with this, and we are committed with the goals of your institution, and I will, me and our society look forward for increasing collaboration that is very fruitful for the Spanish cardiologists and particularly for the Spanish patients.
And for Spanish-speaking patients and Spanish-speaking cardiologists. Yeah. So as you have also mentioned in your questions and your comments, that our relationship with you, and particularly the relationship you have with our Florida chapter, and so many Spanish-speaking cardiologists who live and practice in Florida, this can be extended across Latin America and many of the other Spanish-speaking societies with which we deal. And we would look forward to partnering with the Spanish Society of Cardiology to do that.
So, Dr. O'Hara, thank you very much for this opportunity to be here and to share some comments and some problems that we have the same problems. Yes. in our health system, in our education, and so on. And we are very proud with the relation with you. You are so important organization.
Well, we feel the same, and thank you for this opportunity.
Yeah, thank you,
Jose.
No.
Okay.